Hello to you all. My name is Emma Paulino. I'm honored to open this webinar on community pharmacy regulation, access and remuneration, global trends organized by the International Pharmaceutical Federation. So today we have a distinguished panel of speakers, and this webinar will present select findings from a recent FIP survey on community pharmacy models and self-care. It will provide an overview of trends which are affecting community pharmacies' sustainability, namely the impact of players as Amazon on the evolution of remuneration models for professional services. It will also provide a snapshot of community pharmacy in China. So a very interesting program for you today. And again, welcome to you all. So, like I've already mentioned, my name is Emma Paulino. I'm a community pharmacist from Portugal. Here is a short biography, but the most important thing and the reason why I'm here is that I am the professional secretary at the International Pharmaceutical Federation. And this means that I'm representing the board of pharmaceutical practice within the bureau and the executive committee of FIP. And it is a great honor today to be chairing such an important session on the topics that I've already mentioned. So I would like to start with a few announcements. So for your information, this webinar is being recorded. It is also being live streamed via YouTube and the FIP events website. So the recording will be afterwards available on our website, and you can see the link on your screen. You may ask questions using the question box that has been provided. So I would advise you to use the chat box for any comments you would like to provide, to say hi to everybody, to present yourself like you've been already doing. But if you would like to address a certain speaker and ask a specific question, we would like to ask you to use the Q&A option, which you may find on your Zoom, so that we can ensure that all the questions are answered if we have enough time at the end of the session, of course, for all of them. But we will make sure that you will receive the information that you need. So you are welcome to provide feedback afterwards to webinars@fip.org. We appreciate your feedback and any suggestions and recommendations you may have for future digital events organized by FIP. You are also very welcome to become a member of FIP through our website, and this will provide you not only with the opportunity to participate in these events, which as you know, are freely accessible, but also to a number of membership benefits, which you can also access via the membership registration website. And that includes, of course, participating in the largest platform and network for pharmacists, pharmaceutical scientists, and academic pharmacists and pharmacy educators around the world. So you are very welcome to become a member of our community. We would like to thank Sanofi Consumer Healthcare specifically for supporting this online event. Thanks to Sanofi, we are able to provide this event free of charge to anyone who would like to participate. And Sanofi has been a long-standing partner of FIP, and for that we would like to thank Sanofi for this recognition of the role pharmacists and the pharmacy community provides to public health and to patients in particular. So thank you very much for this support. In terms of today's program, we will have, after this short introduction, we will have a presentation of select findings of the 2020 FIP survey, which I have already mentioned. We will have a presentation from Lars-Ake on community pharmacies in the area of Amazon. Then a brief snapshot of community pharmacy in China by Dr. Guan. And finally, a presentation on remuneration models for community pharmacy services from Sónia Queirós. I will be able to introduce you to the different speakers as they come up in the program. Then we will have a panel discussion, and like I've mentioned, you are more than welcome to insert your questions in the question Q&A box. In terms of learning objectives, we would like you to end the session with the understanding of the impact on community pharmacies, of new digital players and new trends in technology. We would also like you to understand a little bit better the community pharmacy sector in China and overall global trends and examples of evidence-based models of remuneration of community pharmacy services. So these are the learning objectives for our session today. And now it is my pleasure to introduce you the two speakers, so that we will have a double act for this first presentation. On select findings from the 2020 FIP survey. And for this, we will have Gonçalo Sousa Pinto. He's the FIP lead for practice development and transformation in FIP. He graduated in pharmacy from the University of Oporto in Portugal in 2000. He leads within FIP the area of development and transformation of the profession. From this role, he promotes innovation and advocates for the value of the pharmaceutical professional services in the areas of responsible use of medicines, in strategies for the prevention and management of chronic non-transmissible diseases, as well as infectious diseases, which includes vaccination services. He produces publications and tools, which you can also find on our website, to support the work of FIP member organizations in advancing pharmacy practice at national and regional level. So thank you very much for being here, Gonçalo, and for all the work that you have been doing in the past decade, I would say, for all pharmacists worldwide. We also have Rúben Viegas. He's the FIP Practice Development Projects Coordinator, working with also Gonçalo. He's a pharmacist, also from Portugal, with a master's degree in exercise and health from the Faculty of Human Kinetics in Lisbon. He's currently enrolled in a PhD program focused on the promotion of physical activity through pharmacists. He has been involved in different associations and educational activities focusing on the area of public health and pharmacy practice. So like I've mentioned, we will have a double act for this first presentation, and I will now hand over to Gonçalo Sousa Pinto for the first presentation for this afternoon. Thank you.
Thank you very much, Emma, and hello everyone, and thank you for joining this webinar today. As Emma was saying, we will present a few key findings from this survey that we conducted between the beginning of November and the end of January this year. The survey focused on how community pharmacies are regulated and remunerated, what is the role of pharmacists in self-care, and also the distribution of medicines, and also a part specifically focusing on online pharmacy operations. The survey was conducted in 4 different languages, and we invited 137 organizations, including a few non-members of FIP, to participate in a total of 118 countries. And we had responses from 79 of those 118 countries, so that corresponds to a 67% response rate. So over 2/3 of those that could had responded. And the countries and territories that are represented in this study represent or account for 54% of the world's population. So it's quite a representative survey. And I have this point here on the screen, and that's why we have also invited Dr. Guan to participate in today's webinar. China did not participate directly in the survey because the questionnaire did not fully reflect the situation in China, so they preferred to submit a case study, which will be included in the survey report. This report will be launched on the 24th of July, which will be the International Self-Care Day. But the data that we collected through this survey will actually be split between two reports. One of them focusing specifically on online pharmacy operations that will be launched later in the year, and this one focusing on community pharmacy regulation and self-care, including remuneration models and professional services, that will be launched, as I said, in July. And again, we thank Sanofi Consumer Healthcare for their support to this study, to this research that we conducted. Thank you very much. On the next slide, Rúben will be introducing some data on the density of community pharmacists and pharmacies per country. Rúben, back to you.
Thank you, Gonçalo. So indeed, there are in this map, the number of community pharmacies per 10,000 population, which is a good indicator for the availability and access to the pharmacists. You can see in the lighter shades of green, for example, less than one pharmacist per 10,000 population, mainly in the African region. And you can see higher densities of pharmacists in the darker green, mainly in Europe, North Africa, Western Pacific, but also in Egypt, which explains the mean for the Eastern Mediterranean. On the left side, we can see also the number of total licensed to practice pharmacies, and this is around 3.5 million pharmacies, which is a bit less than the previous report, but that's also because some countries like China did not participate this year. And in the lower part of the screen, you can see the number of community pharmacies, and you can see that the average sample is around 2.75 pharmacies per 10,000 population. On the next one, we have the same data, but this time per regions and per income level. So we can see that the light brown circles represent the number of pharmacies, so the density of pharmacies per 10,000 population, while the yellow circles represent the number of pharmacies. So if we compare the relation in size between these two, we can have an average ratio of pharmacists per pharmacy, which is an indirect measure of the capacity for pharmacies to provide different services, from dispensing to more advanced ones. You can see on the right side also this difference per income level. So you can see that in the high income level, there are a bigger ratio of pharmacists per pharmacy. On the lower part of the screen, on the left side, you have all this information in a bar chart. So you can see the difference of this ratio per region and per income country. And although the countries that responded to this survey and the one in 2016, the number of continuous countries, so the number of countries that responded to both surveys, we made a comparison using those numbers, and we can see that there was only a growth in the Euro region and the high-income region, and which is of great concern and might require further investigation on this aspect. Thank you very much, Gonçalo. Back to you.
Thank you, Rúben. And continuing with an overview of pharmacy ownership models and pharmacy establishment models, we have asked, well, the map that you have on your screen represents two models that are either linked, where the ownership of pharmacies is linked to pharmacists only, is restricted to pharmacists, or those countries and territories where it is open to other people that may not be a pharmacist. So this is a fundamental difference. Of course, there are nuances and different models which are represented on the right side of your screen. There are different ownership models, and I will discuss those and present those in a moment. But the map, what the map represents is whether the ownership or the business side, let's say, of a pharmacy is linked to a professional degree and a professional way of managing the pharmacy. And we see that the circles underneath the map express the proportion of countries and territories that have these two situations in 2016, our previous survey, and 2020. And we see that the percentages actually remained quite similar, quite stable, with around 70% of countries allowing other people that are non-pharmacists to own community pharmacies. When we look at in a more granular way into the ownership models, we see that in the most common model, of course, is pharmacies that are owned by pharmacists or societies or partnerships with a majority of shareholders who are pharmacists. And the second most common model, and that's present in 86% of countries, this particular model that I described, and the second one being corporate ownership of pharmacy chains that are present in 72% of the countries and territories in the sample of this study. In the lower part of your screen, you can see these two bars for the 2 years, 2016 and 2020, and these represent the prevalence or of the establishment and distribution criteria. So how the regulation of new pharmacies is established in each jurisdiction. And what we see is that in 2016, for example, 43% of the respondents had indicated that there were no specific criteria so that anyone could open a pharmacy in any location. And so there were no specific regulations in terms of where the pharmacy could be open on when. And this group has diminished in comparison to 4 years ago and is now at 28%. Of course, we would need to provide finer details and investigate further what could have happened. And our report will also shed some light on the nuances there. And in terms of the countries that do apply criteria for the establishment of pharmacies, the most common situation is a combination of geographic and demographic criteria for the opening of new pharmacies. Next slide, please. In terms of the services that community pharmacies are providing and allowed to provide beyond dispensing medicines, we asked a slightly different question. Well, maybe not so slightly different, because we used to ask which services were available or implemented in each country. And this year because that was subject to interpretation. So it could be implemented by a small group of pharmacies in a country, but that did not represent what mainstream pharmacy practice was about in each of the jurisdictions. So this year we asked about a smaller group of services, but in terms of whether they are allowed or not allowed in terms of the regulation of the scope of practice. And we split the list of services that we asked about, this is 15 services, into 4 clusters. The cluster in yellow, you will see that it's services that involve a clinical assessment and a clinical decision-making with regards to the initiation, the continuation, or the modification of a treatment, of a prescribed treatment. For example, it includes independent prescribing by pharmacists or complementary prescribing, but also adjustments to prescribed treatments or therapeutic substitution, or for example, dispensing emergency contraception, or renewing prescriptions for chronic patients with non-communicable disease based on an initial prescription. Then another cluster is services provided outside of the premises of the pharmacy, which including the provision of medicines, but also the provision of pharmaceutical care services, including home medicines reviews, home care, or the provision of medicines to nursing homes or to hospitals, for example, or home deliveries. And within these 2 clusters of services, what we see that, for example, the dispensing of prescription, of renewal of prescriptions for chronic patients, or the home deliveries or home care services have increased and are quite expressive and present in a number of countries. And this could be the result, for example, of the impact of the pandemic. So pharmacies really going out where the community is and facilitating and reducing the pressure on healthcare systems. Another cluster of services is about screening for diseases, and we see that, for example, 18% of the countries in the sample provided COVID testing, screening tests at the pharmacy, and 19% of countries reported the testing for HIV. So these are services that still have room for expansion and really to harness the potential of community pharmacies for the provision of these services. And the fourth cluster, just with one country, is the provision of first aid services at pharmacies, which is present in just over half of the countries with 54%. And you will see that on the right side of your screen, there's a small graph with two circles comparing 2016 with 2020 in terms of the jurisdictions where pharmacies are required to have a private consultation room. And this we have included because it is somehow an indirect condition for the provision of many of these services. So we see that this number has increased, which is a good sign, because it really is linked to the expansion of the scope of practice and services provided by pharmacies. And finally, with this last slide on community pharmacy remuneration models, the map is also in presenting the sort of two predominant situations, which is countries that have a predominantly product-based remuneration models and countries that have a predominantly service-based remuneration models, and then countries that have other models of remuneration of community pharmacies. And we see that by far the product-based models are still very present. I think that Sónia Queirós will be providing a more granular analysis of these data with examples from various countries. But what we see is that the percentage of countries that have a combination of services, of remuneration of services and product-based is also significant, with which are included in the other models, the darker shades of gray, of blue. But of course, all this will also be presented in a more nuanced and granular way in our report to be launched in July. And I think I will leave it at this so that I don't take more of time from other speakers. Thank you very much, and back to you, Emma.
Thank you very much, Gonçalo, for your presentation. We have had a couple of questions on whether these slides will be made available or whether this will be presented as a report, which can be downloaded afterwards. Maybe you can answer already this hot question, and then we will move to speaker number 2.
Yes, by all means. These slides will, well, the slides, these images will be included in the report from this survey, and the recording of the webinar will be available to you through the channels that we mentioned at the beginning, but the slides as such will not be shared beyond this presentation. Thank you.
Thank you. And we have a second short answer question. Is the UK included in the data that has been presented in your presentation?
We did not have a response from Great Britain in this year's survey. No, I'm afraid not.
Okay, thank you very much, Gonçalo. We will save some additional questions to the end, to the Q&A session. So please feel free to insert them in the Q&A box. So we will now move to the second presentation on community pharmacies in the area of Amazon. And for that, we will have Lars-Ake Söderlund. He's the FIP president of the community pharmacy section. And Lars-Ake, I'm sorry, just reaching out to my notes, has an extensive experience of working together with the Swedish healthcare sector in improving health and creating a sustainable healthcare system. He has been vice president of the Swedish Pharmaceutical Society and has had a number of executive positions within Apoteket AB, recently as head of national customers / new business. As I've mentioned, Lars-Ake is president of the community pharmacy section. He's also president of the Swedish national project Check My Medicines. He's in FIP. He's also co-chair of the FIP Congress Program Committee. He is a frequent speaker in Sweden and internationally regarding the future of healthcare in pharmacy, and that's the topic that he will be speaking about today. So, Lars-Ake, the floor is yours.
Thank you so very much, Emma, for that kind introduction. Yes, pharmacy in the era of Amazon. Yes, indeed, we are really living in exciting times. And I will, in my presentation today, try to cover the ongoing development and its possible effects and opportunities for community pharmacy. Forget what you know about pharmacy. Well, this is a slogan on the website of PillPack, the online pharmacy in the USA that Amazon bought for $1 billion a couple of years ago. So could the PillPack slogan be a portent of things to come now that Amazon, the pioneer of one-click shopping, personalized recommendation, prime fulfillment, and customer reviews, has a stake in the medicines market? Well, this in fact is just the latest story in Amazon's journey into healthcare. The so-called Amazonification of pharmacy also includes a deal with the generics company Perrigo that allows Amazon to sell these products under the brand Basic Care. One of the conclusions of this article in the International Pharmaceutical Journal was community pharmacy is an important part of a healthcare system, but this is not a guarantee that it won't be affected by Amazon. Community pharmacy can make a greater contribution to solving the challenges of our healthcare systems by, for example, being the gateway to care, offering screening and disease prevention, and by increasing medication adherence. Amazon doesn't today have the same conditions for doing this, but we must act quickly so healthcare both perceives and experiences community pharmacy as its best strategic partner. The final words were doing nothing is not an option. Next slide, please. What happened afterwards was that Amazon Care became available for all Amazon co-workers 24/7, and Amazon developed a number of health initiatives, including voice technology, started to use its state-of-the-art logistics chain with free home delivery, offered discounts on medicines, joined forces with health and insurance companies, and developed a one-stop shop for healthcare. Click, please. And in 2020, they formally launched Amazon Pharmacy. So far, only available in the USA and in the India, but the name Amazon Pharmacy has been registered in a number of countries, indicating a global approach where it is possible, and all this as a part of digital health. Next slide, please. There are 5 things we should know and need to know about digital health. It's a new virtual world out there. Next slide, please. Technology is changing how patients regard their healthcare. This is not only pharmacy in the era of Amazon, it is the era of digital health. Technology is also changing the approach to medication management, something many of us have positively witnessed during the pandemic. And we must re-envision how pharmacists provide care in this new era. However, digitalization will not replace the pharmacist nor the human face of pharmacy. It is a tool for empowering pharmacists to take an active role in patient care, as well as becoming an integrated and connected actor within primary healthcare. Digitalization is definitely also about people, the power of the patient or the consumer to engage and participate, to become an active, autonomous contributor to their own health. And there are 5 more things we need to know about digital health, and I will only mention them as I assume you are all aware of this development. Digital tools will give you a healthier lifestyle. Your smartphone apps can create better digital health, and I guess all of us have experienced that during the past year. Mobile devices and wearables will transform healthcare, and artificial intelligence will give you better health, but integration remains a challenge. And unprecedented innovations of digital healthcare are everywhere. So digital healthcare has a wealth of developers and researchers creating groundbreaking technology. And if these innovations can be fully realized and integrated, there is no telling how many of our current healthcare problems we can minimize or eradicate together. And we need to remember this is an exponential development. And from this, we need to ask ourselves the questions. Where are we as pharmacists and pharmacies? Are we watching what's happening, or are we an active part of the development? Next slide, please. And if we look at the global trends, they can be summarized in shifting buying behavior, technology-driven disruption with new services and with new actors, pricing and access issues, and self-care and healthcare consumerism is growing. Click, please. And as you can see in this slide, healthcare consumerism is growing rapidly. And the COVID-19 pandemic has shown a bright light on the critical role played by pharmacies, big and small, across all our communities. And local pharmacies in particular have experienced a back to the future moment as they stepped up to help consumers across the countries in traditional ways, serving as an accessible source of advice, comfort, education, and guidance on everything from testing to vaccinations and other safety measures at work and in home. And at the same time, the powerful undercurrent of digitalization and virtualization has continued to transform the roles of the pharmacy and the pharmacist, opening up a potential new avenue as others close, of course. But of course, only for those who adapt to the new normal. And this is not strange at all, because as we live in what I call the digisphere, you and I live here every day, a world where new technology is changing our lives, changing healthcare, and as consumer habits and preferences change, of course, this has an impact on pharmacy as well. And this development is driven by tech companies, niche actors, and click please, 7.5 billion people around the world every day. Next slide, please. Changing consumer or patient preferences means that patients will increasingly demand personalization and a seamless experience in a very complex ecosystem enabled by technology. And pharmacy needs to understand consumers or patient goals, needs, and preferences, and then simplify the journey by way of telehealth, electronic medical records, social health platforms, e-commerce, digital therapeutics, digital services, etc. Next slide, please. This also means that what previously was, for example, a dialogue regarding a self-care symptom in the community pharmacy now can be a totally new before purchase and after purchase process. And where is your pharmacy positioned in this new world, in this new consumer channel with new and changing consumer behaviors and needs? Next slide, please. Apart from Amazon Pharmacy, we do have lots of e-pharmacies and online platforms where consumers can purchase medicines without having to visit the brick and mortar pharmacies. And some examples are mail order pharmacy and brick and mortar pharmacy with online presence, online only pharmacy, and rogue pharmacies or illegal pharmacies, pharmacies that fail to meet regulation criteria or haven't been subject for a regulatory review, license, etc. And of course, illegal drug trade on the dark web, which also unfortunately have seen a growth during the pandemic, and where very many of these illegal online pharmacies can be linked to criminal activities. Click, please. So why do consumers go online? Well, because it's convenience, it's easy access, and also sometimes a lower price. But we need to remember that pharmacy is much more than fast, convenient, and free delivery. The increasing internet penetration and the growth in awareness of online OTC benefits are major factors contributing to the growth potential in many countries. And the importance of pharmaceutical care is also growing with the increase in the need and demand for self-care, such as self-medication. Self-care is gradually enhancing due to an increase in health awareness in the population, both in developed and developing economies. And the increase in demand for self-care is expected also to increase demand for online services, especially for OTC medicines. Next slide, please. The WHO working definition of self-care is the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and cope with illness and disability with or without the support of a healthcare provider. And this is, of course, about making healthy lifestyle choices, avoiding unhealthy lifestyle habits, making responsible use of prescription and non-prescription medicines, self-recognition of symptoms, self-monitoring, and management. Next slide, please. So from increasing consumers' access to health information and services to increasing anonymity and autonomy to continuous monitoring of quality and safety, there are many opportunities for digital self-care interventions to reimagine health services and their implementation, and to do so in a way that it strengthens the health system and the patient. And there are 4 important principles in this area: user experience, data privacy and confidentiality, quality assurance, and accountability and responsibility. And the integration into digital health results in a unique value add that digital technology can bring to self-care: the ability to unify the need for a person-centered approach to healthcare with an approach that strengthens the healthcare system at the same time. Click. And as you can see in this slide, there are many, of course, very positive benefits from digital self-care interventions. Next slide, please. So if we look at this one, we can see in summary, the benefits are increased personal patient empowerment, overcome workforce shortages. We have meeting needs for the healthcare system. And of course, it's a solution to support achievement of all 3 of the WHO's triple billion goals: improve universal health coverage, reach people in humanitarian situations, and improve health and well-being. But of course, there are also a lot of challenges. Unsafe use of unregulated and substandard products, not a regulated area in many countries, incorrect or unclear health information, the lack of access to healthcare personnel and or health facilities, and of course the potential to aggravate inequalities like vulnerable, marginalized, criminalized, or socio-economically underprivileged populations. Next slide, please. So there is a changing healthcare landscape. The rapid evolution of technology is transforming the delivery of healthcare. We have self-administered care with guidance from remote digital consultations. They will play a key role in the future. And there is an estimated shortage of 18 million healthcare workers by 2030. And of course, this is a golden opportunity for pharmacy to strengthen and enhance our position within primary healthcare. And it is estimated that 1 in 5 of the world's population now live in humanitarian crisis. So pharmacy can do a lot more, and we want to do a lot more. Click, please. And during the COVID-19 pandemic, we have actually adapted to the new environment in many different perspectives, like medication refills, home deliveries, access to hospital-only medicines via the community pharmacy, and of course, video calls and telephone appointments, just to mention a few of them. Next slide, please. From this, we can conclude that the future of self-care is about technology and digital healthcare. It's about pharmacists as a core healthcare professional. If we adapt to the new world, it's about telemedicine, telepharmacy. It's about self-care literacy, but also about digital literacy. Telemedicine and telepharmacy, as I said, and self-care, yeah, it's repeated, yeah. And it's about showcasing the value of self-care, how we actually provide value. And from this part, we need to do a lot of research to present, because research is true facts. And I also would like to mention that self-care and pharmacy needs to be part of a national health strategy. If it isn't written in the strategy, actually it doesn't exist. Next slide, please. So there are many, we can see that we have an evolution of the healthcare consumer, and we have the traditional patient, the wellness watcher, and the digital health tracker. All will act differently on the new healthcare market, as well as our consumers. And digital healthcare, telemedicine, and telepharmacy are increasingly relevant in keeping people informed and empowered. Next slide, please. There are many drivers and changes required to ensure pharmacies are better prepared to deliver existing and new services effectively and efficiently, like remuneration of services. We have to adapt to the new technology. We need to have a digitally enabled workforce, and we need to ensure that community pharmacy practice and services are backed up by relevant research. Next slide, please. So from this, we can actually see that We have a change when it comes to digitalization of healthcare and how actually this can support the need for community pharmacy to reposition itself within the value chains. We used to be the only actor with an intimate knowledge of the patient, but in the future, we are one of many different stakeholders with intimate knowledge of the patient. So we are no longer one of the selected very few with visibility to the previous dispensing records, etc., as the world is changing. And that has implications for the community pharmacy. And just to mention one of these implications, the patient will increasingly need help to maneuver the new environment, and the community pharmacist is actually very well positioned to become the guide, because it's all about trust, relationships, competency, expertise, and consistency. Next slide, please. And from this, we can see to the right how pharmacies are actually developed into new, more segmented models. We have consumer specialization and targeting. We have more complex medical support, and we have the physical versus the online presence of pharmacy. So many different models are being developed. Next slide, please. So I would like to encourage you to read more about this ongoing exponential development of healthcare and consumer behavior in this policy statement developed by FIP. And some ways of competing with the new actors are develop pharmacists to become proactive healthcare coaches, capitalize on live pharmacists, because we have very strong bonds with our patients at our pharmacies. We need to capitalize on our location in the heart of our communities. It's unbeatable. And we can beat disruptors at their own game by becoming innovative, adapt and use the new technology, develop digital services, develop on-demand solutions, and become digitally enabled. Next slide, please. So by focus on these areas, as I say, are all linked to healthcare challenges that pharmacy more than ever and better than ever can solve. And by doing this, we can even more strengthen the relationship with our patients in the heart of our communities. Next slide, please. Well, actually, the last slide was not there, so I will just mention it. Online pharmacies need to be regulated in all countries. Partly it's about competition on equal grounds, but more it is about patient safety. And from the perspective of competition and consumer authorities, the online pharmacy regulation should be developed towards well-functioning online pharmacy markets, which at the same time improve customer welfare and guarantee consumer safety in purchasing medicines. And my final words is that in this new world, pharmacy must continue to adapt. We have always adapted to changes, but we need to continue to adapt to the new world. Thank you.
Thank you very much, Lars-Ake, for this very interesting presentation. We already have some questions, but we will save them for the Q&A session. So thank you very much for this thought-provoking presentation. We will move now to the third presentation on the community pharmacy in China, models and professional services. And we are happy to have Dr. Guan participate. She's a deputy chief pharmacist and head of clinical pharmacy office at the Qijing Hospital, affiliated to the 4th Military Medical University. She's familiar with the all work contents of clinical pharmacy. In 2018, Dr. Guan was awarded as the National Outstanding Clinical Pharmacist. Based on excellent scientific research, she was awarded the Outstanding Scientific and Technological Worker in 2019 and won the first prize of Science and Technology Progress in Shaanxi province in 2012. Dr. Guan was invited to give a speech at the International Conference on Pharmacokinetics and won the Best Report Award in 2011. In March 2020, she was one of the principal authors of the SARS-CoV-2 infection expert consensus on guidance and prevention and control strategies for retail pharmacy workforce issued by the Chinese Pharmaceutical Association. So thank you very much, Dr. Guan, for participating in this webinar. And the floor is yours to present us a brief snapshot of community pharmacy in China.
Thank you. Thanks for introduction. I'll share my slides. Good afternoon, good evening, ladies and gentlemen. It's my great honor to participate in this event presenting CPA to introduce the operation models and the professional services of community pharmacies in China. I'm Dr. Guan Yue, working in hospital in which ranks top 10 in China. I've had more than 10-year experience as a clinical pharmacist. I not only care about patients in hospital, but also concern about pharmaceutical services in community pharmacy. My presentation consists of 3 parts: development stages of community pharmacies in China, pharmacies operation models, and professional services. And what else should we do in the future? The prospects. First, I want to talk something about the stages. In recent years, Chinese government has successfully introduced a series of management policies and reform measures to promote the development of community pharmacies and encourage the prescriptions outflow of medical institutions. Furthermore, we promote online plus drug distribution, enforce the services on the internet, strengthen the medical insurance in designated community pharmacies, and improve national utilization rate of medical insurance funds. Community pharmacies in China are under the supervision of NHC, NMPA, and NHSA, which respectively formulates policy to promote pharmacies development, regulates the quality management of pharmaceutical business, and manages medical insurance reimbursement policy. With the strong support of the government, pharmacy retail market in China keeps expanding. As shown in figures, retail medication sales reached more than 400 billion yuan in 2019, up 132% from 2010. With the aging of a population and the expansion of chronic patients, the demand for drug consumption is increasing. In addition, the support of policies and the reform of medical insurance make community pharmacies develop rapidly in quantity and quality. Moreover, the development of 5G communications technology, artificial intelligence, and smart pharmacy enable people to enjoy a more convenient drug purchase experience. Next is the second part, as the main part, operating models and the professional services of community pharmacies in China. Currently, there are 2 ways for people to purchase drugs: to go into a conventional pharmacy in person, or buy medicine on an online medical e-commerce platform without leaving the house. What's the difference? The online pharmacy has many advantages, such as unrestricted by region and space, quick search, easy purchase, and lower operating costs. Well, there are also some disadvantages. just like unable to visualize drugs and uncertain of the delivery time. Those are exactly the reasons why conventional pharmacies cannot be replaced because of real-time communication and getting drugs immediately after payment. Due to the difference of the drug varieties and the purchasing patterns, conventional pharmacies operate in three models: retail or chain pharmacy, intelligent pharmacy, and the DTP pharmacy. And we also have some special pharmacies engaging traditional Chinese medicine. According to a report from the Information Center of our National Medical Products Administration, by the end of the 2020, there were 573,000 pharmacies holding the drug retailing license across the country. Among them, nearly 320,000 are retail chain companies and stores, accounting for more than 50%. As you know, we have thousands kinds of herbal medicines in China. So traditional Chinese medicine pharmacy are distinctive Chinese characteristics. Patients who come to the pharmacy will first be diagnosed by Chinese physicians by looking, listening, questioning, and feeling the pulse. And then individualized treatment plans will be formulated. Of course, the treatment drugs are mainly Chinese herbal medicine. With the rapid development of internet and artificial intelligence technology, a new type of physical pharmacy has emerged. That is the intelligent pharmacy. Such pharmacies are equipped with an automatic drug vending machine, which store hundreds of common drugs. Instead of obtaining drug from pharmacists, customers could get medicine by themselves throughout the purchase process. Let's take a look at this video. This is an intelligent pharmacy. Instead of high shelves, there is an electronic screen. Just type the medicine you want to buy on the screen, add it to the shopping cart, and pay via the QR code on the mobile phone. Then you can get the medicine you need from the pickup area. The whole process takes less than 2 minutes, which is quick and convenient. If you have any questions about medication, the licensed pharmacist will give professional advice. In this pharmacy, many automatic arms take the place of technicians, so saving lots of labor and time. DTP means direct to patient. This kind of pharmacy has developed rapidly over years in China. After treatment in hospitals, patients take their prescriptions to the DTP pharmacy to obtain special medicine and chronic disease medicine directly. Most of them are charged by medical insurance. This business model effectively alleviates the pressure of the hospital, allowing patients with special or chronic diseases to be diverted to DTP pharmacies. If patients have difficulties to get medicines, logistics companies also provide drug delivery service. With the rapid development of online shopping and e-pay in China, online pharmacies spring up like mushrooms. The sales ratio of pharmaceutical e-commerce business increases year by year, in which 58% from third-party services. Pharmaceutical e-commerce models in China include business to customer, business to business, and online to offline. Third-party services provide support of the development of the pharmaceutical e-commerce. China has more than 1,100 online hospitals so far this year. The market scale exceeded 19 billion yuan last year. 5G technology accelerates the development of telemedicine, which expands the range of services in pharmacy. Customers could experience one-stop medical treatment and drug purchase in community pharmacies. Internet information technology optimized the allocation of medical resources and improves the efficiency of medical services. The prescription sharing platform is a new highlight of telemedicine, which achieves the interconnection and real-time sharing of prescription information between medical institution and community pharmacy. This survey showed that pharmaceutical services in community pharmacy are similar to those in hospital. In nowadays, services in pharmacy become more and more diverse. With the deepening of medical reform, our pharmaceutical service model has changed from drug sales centered to patient centered. People not only get medicines in pharmacies, they also get valuable services. These services not only cover the whole process of medication evaluation and guidance, such as establish the health record, provide the guidance, track the whole medication process, and evaluate the efficiency, but also include popularization activity, safety monitoring, and special medicine donation. The last part I want to say, in my opinion, in future, we have lots to do. We should continue to constantly enhance the professional competence of pharmacists, expand pharmaceutical services, promote intelligent pharmacy, carry out a family pharmacist, obtain a qualification for special medical insurance, cooperate with the hospital, and regulate the management of medical data sharing. These measures will make our pharmacy more humanized. In recent years, Chinese pharmacy has developed rapidly. We hope to have more and more opportunities to communicate with the pharmacists all over the world. That is all my contents. At last, I want to introduce you my city, Xi'an. 13 dynamics places their capitals here. It is an eternal city, records the great changes of the Chinese nation, just like a living history book, such as terracotta warriors and horses, well-possessed city wall from Ming Dynasty, and the mountain Hua, etc. And any visitor to Xi'an cannot refuse the attraction of hundreds of local snacks. Welcome to China. Welcome to Xi'an. Thanks for your attending.
Thank you very much, Dr. Guan, for your presentation. Very interesting and new ways of looking how we can interact with the public. We have again some questions, but we will leave that to the Q&A section, and I would encourage all of you to submit your questions for our discussion. Next, and finally, we will have our final speaker on remuneration models for community pharmacy services, equity of access, sustainability, and evidence-based incentive models. So, and I'm glad to present to you Sónia Queirós. She has a pharmaceutical sciences degree from the Faculty of Pharmacy of Oporto University from Oporto. She has a master's in health economics and policy, School of Economics and Management of Minho University in Braga, also in Portugal. She has advanced studies in public policy, School of Sociology and Public Policies of the University Institute of Lisbon from Lisbon, Portugal. And she has been head of institutional affairs since 2018, international affairs since 2010, and head of Brussels office of the ANF, which is the National Association of Pharmacies from Portugal. She also has in her curricula having been in charge of as technical director of the pharmaceutical industry, and she also was technical secretary of the Oporto branch of the Portuguese Pharmaceutical Society. With that, I would like to hand over to Sónia Queirós, who will present us on remuneration models for community pharmacy services, equity of access, sustainability, and evidence-based incentive models. Thank you so much. Sónia, the floor is yours.
Good afternoon, everyone. First of all, I would like to thank FIP for the invitation and congratulate the organization for being able to organize a very complete digital program all over the year despite the pandemic situation. Next, please. We live in a changing world. Different forces are transforming healthcare, and community pharmacy remuneration is also part of that transformation. Medicines dispensing is and it will always be the core of our activity and the main component of pharmacy remuneration. But pharmacy remuneration models need to evolve to address challenges and to adapt to an expanded role of pharmacists. In many countries, we have to work in a context of decreasing margins and prices and healthcare budget constraints. And as it was pointed by Lars during his presentation, this is happening while we face competition from other players, including supermarkets and new entrants in the healthcare market, such as Amazon, Uber, and Glovo. So we need to evolve to new models answering to the needs of our patients and consumers, providing new and innovative solutions to an increased demand for convenience, facilitated access to new products and services, not only on health, but as well on well-being. And remuneration models are key to transform professional practice. Next slide, please. To achieve this, we need to align our goals to the health policy priorities of our countries. We need to transform health and social needs in opportunities to reinforce the role of community pharmacies. Pharmacies can contribute to address those needs, providing services to increase access, reduce inequalities and inefficiencies, while improving health outcomes in several areas such as aging population, chronic diseases, polymedications, adherence and prevention. And the time to change has come. Next, please. The COVID-19 pandemic is reshaping healthcare systems all over the world. There is an urgent need to optimize health system capacity. The majority of countries are still facing barriers on access to healthcare, reporting problems on access to GPs, to surgery, to cancer screening, and in many other areas, which will have a long-term impact on the health status of the population. Next, please. During the pandemic, in many countries, were given expanded powers to community pharmacies to ensure continuity of care. Some examples is the renewal of prescription, dispensing of hospital medicines for community pharmacies, deliveries at home, testing, vaccination, not only COVID-19 vaccination, but as well flu vaccination. During the pandemic, we saw an increase on the number of countries with pharmacy-led vaccination services. In some of the countries, this was done by changes in the legal framework and remuneration for the provision of some services. And the contribution of pharmacies is now being recognized by the international organizations such as OECD, highlighting the opportunity to change traditional roles of the different healthcare providers, granting new roles to pharmacists. So COVID-19 pandemic, despite the devastating effects on health, is also an opportunity for change. Next, please. Remuneration of community pharmacies need to adapt and be prepared to a new health ecosystem driven by the acceleration of digitalization that is transforming the role of community pharmacy. We need to be prepared to a future where pharmacy will be a healthcare hub for the community, virtually and physically supported by digital technologies, a central and focal point for helping people finding care, prevent or manage illness at home or at the pharmacy, with integration and collaboration with other healthcare providers and payers. Next, please. And to adapt to the evolution of the profession and health systems, remuneration models are evolving from pure margin systems to fee-for-service to pay-for-performance. And this transformation from the reimbursement of dispensing to payments related to quality and value are based in the measurement of the impact of communities' pharmacies' intervention to achieve better health outcomes through data and intelligence. These new models also promote an alignment with pharmacies and payers to address health system needs and to promote the collaboration with different stakeholders and other healthcare professionals. Next, please. And using the example of Portugal, we evolved from a margin system to a different relationship with our government based on an agreement including remuneration for dispensing, expanded role of pharmacies, and evaluation of pharmaceutical services that was key to change the way that community pharmacies are perceived by the NHS, by the other healthcare professionals, by people and other stakeholders. Next, please. It's still a work in progress, but these agreements enable us to establish a new framework for the remuneration of service based on the added value for people and to the Portuguese health system. We were able to achieve important milestones such as generic incentives and the evolution of pharmacy regulation, remuneration of needle exchange program, and it was the starting point for the dispensing of hospital medicines through community pharmacies. Next, please. The legislative evolution clarified and introduced new services in the regulation, including nutrition consultation, treatment of wounds and care for ostomy patients, diabetic treatment of diabetic foot, and point of care testing. Next, please. And now we are working in the diversification of our remuneration, promoting partnerships with different stakeholders, such as pharmaceutical industry, with the implementation of services that are remunerated to promote the correct use of medicines and medical device and adherence programs, partnerships with private companies to provide service to their employees, and the most relevant, partnerships with health insurance companies, which enables integration of pharmacies in the healthcare provider network in similar ways to GPs and dentists, for example, and the remuneration of pharmacy services. Next, please. In alternative to NHS funding, we are also working at regional and local level. We are working with municipalities to implement individualized dosing preparation by local community pharmacies to the residents of the municipality. This program is in place in 2 municipalities already, targeting elderly or chronic patients taking several medicines. Last winter, for the first time, and we are vaccinating since 2007, but is a private services. Last winter, we were included in the NHS vaccination campaign. This service was available in pharmacies free of charge to 65 plus people without the need of a prescription. And the remuneration of pharmacies was funded by some municipalities, and the vaccines were part of the NHS stock. Finally, we are working with the regions. Right now, we have partnerships with the autonomous regions of Azores and Madeira and municipalities 4 municipalities so far, including Lisbon, to provide COVID-19 tests to the population through the integration of pharmacies, international testing network, and international reporting system. Next, please. So, the evolution to remuneration models based on value means that the contribution of community pharmacies must be measured in different dimensions. And the remuneration models must ensure equity of access to medicines and services, which are as well health priorities at global level. We are the healthcare service closer to the people through an equitable distribution of community pharmacies. We are open 24 hours every day of the year. We have qualified health professionals guaranteeing permanent access to community pharmacists. We all know that these, along with high levels of trust and satisfaction with the profession and the service that we provide, are the main assets of the pharmacy network. And the published evidence showed that pharmacies increase access and reduce inequalities as well. In Portugal and Spain, we can find similar results on the evaluation of the dispensing of hospital medicines for community pharmacies during the pandemic, increased access, reduced costs to the patients and health system, and reduced absenteeism to work. Same results on vaccination, pharmacists' involvement in immunization as educators or facilitators or administrators increases the uptake of immunizations. And more important than that, many people are vaccinated for the first time at community pharmacies. And again, same results on colon cancer screening in Switzerland. Access in pharmacy encourages the population to perform the screening and contributes to early identification of colon cancer. Next, please. In a context of limited financial resources, remuneration models also need to ensure sustainability in a win-win situation to health systems and pharmacies. And again, two examples of published evidence on the added value of community pharmacies and the savings to the healthcare system. The most relevant, in my opinion, is this study done in England that concluded that the expected amount of public sector spending saved directly as a result of community pharmacy services, and they only evaluate 12 services, is sufficient to cover the entire amount of public funding provided for community pharmacy in 1 year. So this is the proof that if we have a fair remuneration of community pharmacy service, we are also promoting better health outcomes, but as well savings to the healthcare systems. Next, please. The evolution to evidence-based remuneration models need to assess the different dimensions as we saw, including access, health outcomes, cost effectiveness, both for patients and health systems. We need to use the full potential of data, not only to shift from volume to value, but as well to explore and expand our role in new fields related to data and intelligence. Examples of these are HTA, predictive models based on dispensing data, for example, to predict peaks of flu, and in the collection of patient-reported indicators. With evidence, we can achieve sustainable remuneration models based on the added value of pharmacies' interventions. And to finalize, two examples of a service that follows these principles. In Portugal, the needle exchange program was remunerated based on the evaluation of the pharmacy interventions. We have evidence that the participation of pharmacies in the program decreases inequalities of access, reduces new cases of HIV, HCV, with savings to the national health system. And in England, the continuation of the remuneration of the new medicine service was based in evidence that this service is effective at improving adherence with better patient outcomes at reduced costs to the NHS. Next, please. To conclude, in many countries, community pharmacies' remuneration is evolving from dispensing to the provision of services to value-based remuneration models, promoting the integration of pharmacies in multidisciplinary health teams. Sustainable and fair remuneration models must reflect the contribution of community pharmacy to people-centered healthcare systems, promoting universal health coverage, decreasing health and social inequalities, meeting patients and health system needs in alignment with health priorities and supported by evidence-based policies. And to finalize, I would like to highlight that FIP is providing the tools to achieve this through the FIP development goals, enabling the transformation of pharmacy practice based on the value and evidence of our interventions. Thank you very much.
Thank you very much, Sonia, for your presentation. And I think it's also worth mentioning that you have also been a member of the OneFIP Data and Intelligence Commission since 2020, and also a member of the Global Pharmacy Observatory Advisory Committee of FIP. And this is very valuable information for us to collect and of course discuss also in those forums to then be able to exchange with the member organizations. So now we have a few minutes left, and the speakers were kind enough to answer many of your questions, which you have put in the Q&A box. So most of them are already answered, but I would like to use this time for some questions still to our panelists. And maybe I will go to Dr. Yue. I know that Dr. Guan is actually writing an answer, but maybe you could give this orally. What is the most common barrier between a community pharmacist and a patient in China? Maybe you can answer this question live. Dr. Guan? Well, I think that Dr. Guan is really invested in answering the question in the written. So maybe I will go back to Sónia. We have a question from Ahmad. And he asks, how about willingness to pay issues related to remuneration? Do you have anything to say about willingness to pay and how this impacts on remuneration model, or whether you think it should impact or not?
I think it has the impact for sure, especially when we look to the governments that are always dealing with the healthcare budget constraints. That's why we believe that it's so important to show the contribution of pharmacies in these different dimensions. And as we saw, we have several examples that a fair remuneration system promotes savings to the healthcare system. So this is a win-win situation, both to community pharmacies and also to the governments. And if we look as well, for example, just to give an example, the vaccination service in Portugal that is in place since 2007 is a private service that is paid by the patients. And we see high levels of satisfaction with the provision of this service in pharmacy, and a very significant number of people that still prefer to go to pharmacies. So people are willing to pay for this, for the convenience and the proximity and the quality of service in pharmacies. So I think we have several evidence that is possible to achieve fair remuneration systems with payments by patients, payments by health insurance companies, payments by the governments. We can have this balance between provision, fair remuneration, and better health outcomes for sure.
Thank you very much for your reply. And now I will go to Lars-Ake with the question that you've actually already provided a written answer, but I think that it is worthwhile exploring. And it's about technology implementation versus outcomes, and whether it is worthy for small to medium pharmacies. So I guess that we are talking about competing with these technology giants. How does a small community pharmacy in a way, can the community pharmacy have a return on investment in terms of implementing new technologies? Well, and how can this be achieved?
Of course, it is a challenge because it can be very costly to implement these technologies. One way of doing is, of course, to collaborate with other small actors and together become a pretty big actor, and by that being able to negotiate the price. But also we need to remember that everything doesn't need to be invented by ourselves. There are so many different solutions out there, so we can actually purchase them or lease them to our pharmacies. And by being part of a bigger community, you will also get all the updates constantly. So you have the system, I mean, up to date more or less every day. If we look at the future of community pharmacy, I think I see it as at the juncture of digitalization and the consumerization or democratization of healthcare, if you would like to express it like that, and driven by a set of interrelated forces. And one model can actually be the local pharmacy in the heart of our communities, with services such as those I did describe in my presentation very rapidly, the 4 different corners: prevention, detection of diseases, minor ailments or symptoms, and the work with the non-communicable diseases. We have a very strong bond with our consumers and customers. And in the end, it's all about trust. Who can you trust? If everyone is equal, who do you trust? Well, it's about creating this very important bond. And we have a very strong relationship with our customers. So that is one way of doing it as well. And collaboration, of course. Use the member organizations in your country to find different solutions. I mean, they are working for you as well.
Thank you very much, Lars-Ake, for your answer, which I think is even more complete in terms of what the question was, but really inspires us into looking at the future and how small businesses as brick and mortar community pharmacies can address these new opportunities and challenges, of course.
Yes, and Emma, we did also mention, and Sónia did it, research and evidence. It's so important. And I usually say that people don't care how much you know until you show that you care. And we need to show the evidence of the work we are doing. We're doing a fantastic work every day all over the world in our community pharmacies. But do we talk about it? Do we present data about it? Do we talk to the politicians and patient organizations? How can we strengthen the bonds with our stakeholders?
Thank you, Lars. So now going back to Gonçalo, you have been conducting several surveys for FIP over the past few years. What have you seen as major differences, and how do you see things evolving from the helicopter view in terms of what types of challenges and how pharmacies have been adapting to those challenges over time, and in particular in terms of the provision of services and on the other hand the remuneration for those services?
Thank you, Emma. Indeed, I think that every time we conduct a survey, we identify that, for example, more countries are introducing a diversity of professional services by pharmacists that go beyond dispensing and including vaccination services, for example. And you might have seen that vaccination services were not presented in the slides that we showed. And the reason for that is simply because we had conducted a survey specifically on vaccination only a few months before this one. So then we published a specific report on vaccination services in August last year, which is also available on the FIP website. But of course, that's an important area of services that contributes, as Sónia pointed out, to increasing the uptake and the vaccination coverage. So that delivers value for society, for individuals, for health systems in general. And as Sónia and Lars-Ake also highlighted, we're seeing how our member organizations and pharmacy in general is advocating and achieving the remuneration of these services by third-party payers, by either public or private. And this is really although it is a gradual process that will take time, because it's a major transformation of pharmacy practice itself, not just the way that we are remunerated. But to achieve this remuneration for these services, it is essential to collect the data of the impact, because no third-party payer will ever agree to remunerate any services that are not based on solid evidence of the value that they deliver to services and to patients. But the WHO themselves have defended and argued that we are evolving towards these remuneration models and funding models for healthcare systems that can include various players and various stakeholders and various ways of funding healthcare. So if we demonstrate that these services actually generate more servings than what they cost for these payers, they will be, of course, be willing to transform that. And we see that survey after survey, that there are more services that are being paid by third-party payers.
Thank you, Gonçalo. And maybe I can go back to Sónia, because you were talking about the importance of evidence. And at FIP, we are very much looking forward to creating a larger platform and network for the exchange of information about for evidence of the return on investment that also governments have and the private insurance has in terms of pharmaceutical services. Sónia, do you think, and this is a major discussion, do you think that international studies from other countries can be used and useful to advance for new remuneration models in a certain country? Or is it necessary to produce evidence that is applicable to the national context to really influence governments to change remuneration models or convince them to pay for a new pharmaceutical service?
The international benchmarking, not only on the provision of service, but as well on the evaluation of the impact of community pharmacy interventions, is for sure key to advocate at national level. It's also a way to have some already some base to work on national level to implement and evaluate the service that we are implementing. So I think it's both. We need to have international evidence, we need to have national evidence, and it would be as well very valuable to have some kind of guidelines or harmonization that can foster evidence, the production of evidence and intelligence in different countries that we can compare at international level. So with different studies in different countries, we would have a global and more comprehensive again, data and evidence of what is happening and the value of our interventions. And FIP can contribute for that for sure.
Thank you very much, Sónia. And maybe because we have 2 minutes to finish our presentation, maybe I would like to hand over to Lars. He has his hand up, so I guess he also wants to contribute to this question. But I would also ask because we have a question from Aku. In 2012, the FIP had a working group that worked on professional ethics and professionalism. From the presentations, I wish to know if with the diversity of pharmacy practices, can this FIP initiative be achieved? So I guess that what do you see is the impact of these different ways of interaction with the public in terms of professional ethics and professionalism? And of course, you are welcome to add on the previous question as well.
I just wanted to comment on Sonia's response that we have the Global Pharmaceutical Observatory, which is a bank of resources within FIP available for all member organizations. And there we can find so many different examples of successful implementation of services, different models for remuneration, etc. Of course, they need to be adapted to the local country, but still it's a most valuable resource and it's growing every day with new examples.
Can you give us your perspective on the impact of these novel practices in terms of ethics, and whether, how do you think this, what do you think about this alignment?
Well, actually, yes. It raises the concern of the ethics discussion, I think, because, and it's also about values. Different generations are more or less keen on sharing data, personal data. We have different preferences, etc. But still, it is a discussion I think that we need to raise. And actually, I have been thinking about it myself as one of the topics, perhaps for next year's Congress in Seville, to revisit this statement and see how it needs to be adapted to the new future. And this new future is actually being developed at exponential rate every day. So it's necessary.
Yes, thank you, Lars. And just to add on that, we had a working group in 2012, and then they produced a reference document on this topic and also a statement, which we obviously continuously want to update. But there we continue to hold a forum for those interested in ethics. It's usually organized within our FIP conferences. So unfortunately for these 2 years, we haven't had that opportunity to exchange on this topic, but I'm sure this is led by Dr. Betty Char from Australia, and I'm sure that when we resume our face-to-face conferences, that we will hold other forums for pharmacists and other individual FIP members that are interested in these topics of ethics and professionalism. So I think it is a good discussion also to hold at that forum. Well, we have reached the time limit for our webinar. I would like to thank all presenters and all participants for your participation. We had a lot of questions. They were all answered either live or in written form. In any case, if you have any further questions or you would like any clarifications about what was presented in this webinar, please feel free to contact us, and we will try to forward the question to the presenter that is most appropriate to answer the questions. I would like to thank all the speakers again, Gonçalo, Rúben, Sónia, Lars-Ake, Dr. Guan, for participating in this webinar. And thank you all, and we look forward to seeing you soon in one of our FIP webinars, which we are holding every week. So you are more than welcome to view our agenda and choose which ones you would like to participate in. Thank you so much. Thank you again to Sanofi Consumer Healthcare for the support. And that's a wrap. Thank you very much, and have a good day, afternoon, or evening around the world. Thank you.
Thank you.
Thank you very much.
Bye-bye.
Bye, everyone.